Africa Regional Director, Dr. Matshidiso Moeti. So she'll be giving us an update on the Ebola outbreak and what it means just in terms of the region and the lessons learned. She will also be joined by Professor Jean-Jacques Muyembe Tamfum, who is the Director General, National Institute for Biomedical Research. And he'll be speaking about the Ebola outbreak. As you may know, he has been dubbed as the Ebola hunter by the Lancet. So he knows quite a bit about that, having been very much instrumental in the discovery of it. And the Honorable Dr. Eteni Longondo is the Minister of Public Health in the Democratic Republic of Congo. So he'll be talking about how the WHO and the country joined forces in dealing with this. And I must mention, ladies and gentlemen, that Dr. Moeti is joined in Brazzaville by Dr. Michael Yao, who is the Program Manager Emergency Response at the WHO. So he'll also be on hand to just deal with some of the questions that may arise. Just some quick housekeeping notes. Please remember that we will be taking questions during the question and answer session, but that you please identify yourself and the organization from which you are asking the question for or whom you're representing. And there will be simultaneous interpretation in both English and French. So if you could just look at the bottom of the Zoom app, there is an option for interpretation.
Oui, donc pour les Français, pour choisir le flux audio en français, il vous faut aller dans le menu de l'application en bas de Zoom et vous avez un bouton interprétation et vous pouvez sélectionner le petit drapeau français et vous entendrez toute la conférence traduite en français. Merci.
So if I were to say that in French, je parle pas français. So I hope you understand that's why I can't do the interpretation for you. But just to let you know that we are going to be live streaming this and we're going to be posting the briefing on YouTube that you can go to WHO Africa Twitter and Facebook accounts as well. But let me not take too much time. Just a reminder, Dr. Matshidiso Moeti, who's the WHO Regional Director for Africa, to have the first word on this. And I just would like to alert all of the speakers that we have about 2 minutes so that we can keep to time. Dr. Moeti, it's over to you.
Much, Tsepiso. Good afternoon, everyone. Bonjour à tout le monde. And thank you very much for having joined us today. I'm very happy also to be joined by the Honorable Minister of Health of the Democratic Republic of the Congo, as well as our colleague, Professor Muyembe, the Director General of the National Institute for Biomedical Research. Honorable Minister, I'd like to commend your tireless commitment and through you appreciate the leadership of the President of the DRC and the sacrifice and perseverance of 16,000 frontline responders and most importantly, communities in North Kivu and Ituri provinces who have brought about the end of this 10th Ebola outbreak in the country. I'd also like to appreciate the African Union, Africa CDC, UN agencies, non-governmental organizations, and bilateral partners, and the more than 1,500 WHO colleagues who got deployed to this response for their contribution to this significant achievement. Most of all, I want to thank the people and to pay tribute to the health workers, including WHO experts who either got ill, were injured, and those who lost their lives during this response. A special words of thanks also for Dr. Tedros, our Director General, who will be joining us shortly, as Tsepiso said, for leading from the front and being very present in the field. It wasn't easy. And at times it seemed like a mission impossible. Ending this Ebola outbreak is a sign of hope for the region and for the world that with solidarity and science and courage and commitment, even the most challenging epidemics can be controlled. Working together, we leave an enduring legacy, which is now supporting the fight against COVID-19 and the other outbreaks. So after almost 2 years of building preparedness and response capacities for Ebola, the DRC and its 9 neighbors have stronger skills, systems, and capacities in place to manage a range of emergencies. We have coordination mechanisms, surveillance platforms, points of entry screening, contact tracing strategies, isolation facilities, and some best practices and lessons learned to engage and enable communities. And these have been quickly activated in response to COVID-19 in the DRC and in these countries. The new Ebola outbreak in Bandaka, in Equator province in the DRC, along with measles outbreaks in the Central African Republic, in Chad, in the DRC as well, in South Sudan and other countries, and an increase in malaria in some countries in Southern Africa compared to last year, are all reminders of the need to ensure continuity of essential health services for other life-threatening conditions, while at the same time fighting COVID-19. There are now more than 332,000 COVID-19 cases on the African continent, and 8,700 people have lost their lives. And as of this week, Africa is no longer the WHO region least affected by COVID-19. In a bid to balance economic concerns and a drive to end the epidemic, countries are easing social measures, and in some settings, this is leading to an increase in cases. To save lives and protect livelihoods, response measures should be adjusted step by step with data driving the decision-making. In the past week, 10 of 47 countries in the region accounted for 89% of new cases, and 5 accounted for 80% of new deaths. In some countries, more than 5% of infections are among the healthcare workers. This is a huge concern because of the safety of frontline workers, which is a priority for their ability to provide services to everybody. When they are absent, then communities are at greater risk. We're also seeing some cases among refugees and internally displaced people who are living in crowded conditions where this virus could easily spread. Key supplies continue to be a challenge, and here I'm speaking particularly about personal protective equipment and test kits. And we are working with the African Union and the UN, other UN agencies and partners on improving procurement. So this pandemic continues to require vigilance and an all of society approach in prevention and in response. I congratulate once again everyone involved in ending the 10th Ebola outbreak, Mr. Minister, the head of state, the government in the DRC, all the teams and partners that we're working on this. And I'm convinced that by working together in a similar way, we will also get to defeat COVID-19. Thank you very much, Tsepiso.
Thank you very much, Dr. Moeti, as somebody who's been very instrumental in dealing with a fragile context. This is very important, especially universal health coverage, which is something that I know that you have been working very hard to. And we have seen that in the Democratic Republic of Congo as being something that has been somewhat of a barrier. And this is why we're going to ask Professor Jean-Jacques Muyembe to talk us through how they came to this point of ending the 10th Ebola outbreak and what they're doing in terms of the 11th Ebola outbreak, what preparations are afoot. So Dr. Muyembe, Professor Muyembe, let me just hand over to you.
Merci. En fait, en août 2019, les chefs de l'État nous confiaient la gestion de la riposte contre la maladie à virus Ebola à l'est du pays. Une moyenne de 15 cas par jour était notifiée dans 29 zones de santé dans les provinces du Nord, du Sud Kivu et de l'Ituri. 4 mois plus tard, nous avions réduit le nombre de cas à 3 par jour et à 6 le nombre de zones de santé affectées. Aujourd'hui, nous célébrons la fin de cette crise après une résurgence rapidement maîtrisée. Nous attribuons ce succès à la combinaison de plusieurs facteurs, notamment 1. la forte implication des autorités politico-administratives, notamment celle du chef de l'État, qui avait mis en place le comité multisectoriel en intégrant les autres secteurs dans cette crise sanitaire. Celle du Premier ministre et du ministre de la Santé, qui avaient alloué les ressources nécessaires, et celle des 3 gouverneurs de province et des maires des villes affectées qui avaient mobilisé leur population. 2. L'ancrage de la riposte dans les systèmes de santé par un transfert progressif et régulier des compétences aux divisions provinciales de santé et aux médecins chefs de zone de santé en vue de renforcer le système national de santé. Et 3, c'est l'engagement communautaire qui a été lent et difficile au début, mais qui s'est avéré déterminant pour la victoire de ce jour. 4, c'est l'appui et l'alignement de tous les partenaires techniques et financiers sous le leadership national. Et à cette occasion, je remercie tous les partenaires qui ont apporté une contribution inestimable à la réussite d'aujourd'hui. Et enfin, 5, le recours à des innovations technologiques telles que les vaccins et les molécules thérapeutiques grâce à la recherche clinique qui était réalisée pendant la riposte à la maladie à virus Ebola. Donc, désormais, la maladie à virus Ebola a un vaccin et un traitement spécifique. Alors, comment la RDC va faire pour lutter contre la 11e épidémie à la maladie à virus Ebola dans la province de l'Équateur? La riposte à la 11e épidémie dans la province de l'Équateur repose sur l'expertise locale, avec l'aide, bien sûr, du gouvernement central et des partenaires. Donc, les contacts des cas confirmés seront vaccinés et les malades isolés dans le centre de prise en charge seront traités avec 2 molécules, les MAP 114 et les régénérons que nous avions utilisés durant la 10e épidémie au nord Kivu, sud Kivu et dans Ituri. Voilà un peu comment nous voyons et nous sommes très fiers d'avoir donc eu cette victoire sur une épidémie qui a duré dans le temps et dans l'espace et qui a fait beaucoup de dégâts dans notre population. Merci de votre attention.
Thank you very much, Professor, for sharing your insights. And let's get further insights now on how the Democratic Alliance, or rather the Democratic Republic of Congo, is using this opportunity to fight COVID-19. Honorable Dr. Eteni Longondo is the Health Minister.
Hello?
Yes, you can go ahead, Dr. Longondo. The floor is yours.
Yeah, because I don't have the video here, but I'm going to talk if everybody.
Yes, we can see you. We can hear you.
I will talk in French. Bon, je voudrais d'abord remercier l'Organisation mondiale de la santé pour avoir organisé cette rencontre. Et je crois que je vais parler beaucoup plus sur notre expérience au Congo par rapport à la lutte contre Ebola et comment cette expérience pourrait être capitalisée dans la lutte contre la COVID-19. Donc, comme vous savez, les 2 maladies sont causées par des virus. Et à plus de 90%, je crois que le mode de prévention sont les mêmes au niveau de la communauté. Et vous savez, c'est depuis plusieurs années que nous avons Ebola ici au Congo. Et la population, là où nous avions connu l'épidémie à Ebola, est engagée dans la lutte. Et c'est ainsi que ces mêmes populations, comme vous allez le constater, connaissent déjà les mesures barrières, donc les mesures qui favorisent la prévention de cette maladie. Et vous allez constater que à l'Équateur, qui a connu, c'est une province qui a connu la maladie à virus Ebola, et la population était déjà sensibilisée à l'époque, et la population connaît les mesures de protection, les mesures de la lutte contre cette maladie. Et vous avez remarqué, selon les données, que nous avions eu seulement un seul cas. Et jusqu'à aujourd'hui, le cas, il n'y a pas eu un nouveau cas. Au Nord Kivu et à Nituri, là où nous avions aussi la maladie à virus Ebola, je crois que nous avons de moins en moins de cas de la COVID-19. Ceci s'explique par le fait que la population a intériorisé les expériences de prévention contre cette maladie à travers leur connaissance de la lutte contre la maladie à virus Ebola. Le professeur Muyembe a parlé de l'ancrage de la lutte dans le système de santé. Et cette expérience dans le système de santé est en train d'être utilisée, n'est-ce pas, dans le cadre de la lutte contre la COVID-19. Donc, c'est pratiquement la même stratégie de la lutte, c'est pratiquement les mêmes méthodologies de la lutte. Et nous, pendant les épidémies à virus Ebola, le professeur a expliqué que nous avions utilisé le système de santé qui existe déjà pour lutter contre cette épidémie. Et on est en train de faire la même chose avec la lutte contre la COVID-19. Nous pensons que nos zones de santé, nos aires de santé sont en train de se débrouiller pour lutter contre la COVID à partir des expériences antérieures de la lutte qu'ils ont acquises dans la lutte contre...
Dr. Longondo, if you'll allow me to interrupt you and stop you there so that we can keep within time and allow your contribution to also be reflected from the questions that are coming through, because there are quite a few. And I'd just like to point out to the journalists or those who are participating in this press briefing to please go onto the Q&A icon at the bottom of the Zoom feature and ask your questions there. Unfortunately, we're not having any questions come through that channel at the moment, but we have had other questions. Let me start then with the questions that have come through. I'm going to just point them to the participants. This one is from Ochieng Ogodo in Kenya saying, what are some of the most important lessons that you think Africa could learn from Ebola and the COVID-19 outbreaks? And we've also got another call from Paul Adepoju, who's from the Lancet in Nigeria, saying the question is on the DR Congo's high number of gene sequences. I'd like to ask how the Ebola pandemic brought about the acquisition of additional capacities, enabling the country to better respond to an entirely different viral disease. So let me first start with you, Dr. Moeti, on that first question. What lessons have been learned, the nexus between COVID-19 and the Ebola outbreak?
Yes, thank you very much for that question. And I think it follows very well on what the minister just said, what he said at the beginning and the focus of his remarks. One of the most important lessons that have been learned is the need to engage with, work with, enable communities to be knowledgeable, to be empowered to play their role in different ways. I think that was one of the most important lessons to come out of the Ebola outbreak. And it's extremely relevant for the COVID-19, where again, people are being asked to protect certain behaviors, do certain things to protect themselves, to wear a mask when you're going outside, to wash your hands. And the enabling part is that we need to understand when people need to be provided with the wherewithal to be able to follow this advice. In this case, meaning masks need to be provided, water for people who have difficulties at home to have access to water, or some of these sanitizing products. Secondly, we've learned great lessons about how to innovate in the middle of a pandemic, how to learn, how to develop new technologies. The professor referred to the fact that at the same time as the response was going on, there was work to discover new therapeutics, a new vaccine, and these were being deployed at the same time as the data was being gathered on their efficacy, and on the safety data had already been gathered. So we can be learning at the same time as we are deploying an important tool to have an impact on an outbreak. And then thirdly, we have seen the importance of the resilience of health systems. So one of the lessons that I take away is that we must invest in health systems when we do not have outbreaks going on, because it makes a huge difference then in the capacity to rapidly put in place a mechanism and all the actions that are needed to contain an outbreak. I can just briefly say these are, for me, some of the most important lessons learned.
Thank you very much, Dr. Moeti. And there was another question that was asked from the Lancet, but I think to follow up, we'll get Professor Muyembe to answer that question. But I think to follow up, there's a question here from Amy Maxman saying that what will be the big challenge in ending the 11th outbreak in the equator? There's a vaccine and experience, but will it still be difficult? Dr. Longondo, perhaps you'd like to answer that question. We'll come back to Professor Muyembe on the issue of strains and the other question from the Lancet.
Je crois que je vous remercie pour la question. Je crois que la difficulté principale que nous avons, c'est beaucoup plus, c'est une maladie, cette fois-là, la 11e épidémie, elle est en train de migrer, n'est-ce pas? Ça a commencé en Mbandaka et on a maîtrisé en Mbandaka, et puis maintenant c'est dans d'autres villages que ça a commencé, et heureusement que nous sommes en train aussi de maîtriser de ce côté-là. Mais je crois que avec le vaccin, parce que pendant les épidémies antérieures, la 9e jusqu'à la première épidémie, nous n'avions pas eu de vaccin. Et je crois qu'avec le vaccin, ça rend notre lutte un peu facile parce que la population est déjà engagée et nous avons la population qui réclame d'elle-même le vaccin. Et aussi, la population est engagée du fait qu'elle est en train de sensibiliser aussi à Mbandaka. Quand vous allez à Mbandaka, vous allez trouver que les communautés sont en train de s'organiser pour sensibiliser les autres. Donc, la lutte sera beaucoup plus facile, mais le problème, c'est que elle est en train de migrer, la maladie. Donc, quand vous attaquez une région, après demain, vous allez attendre que ça se trouve dans une autre. Et nous avons déjà développé des stratégies pour que nous puissions contrer tout cela. Merci.
And thank you. Thank you very much. So let's now go to Professor Muyembe to answer this question, but I must also point out that...
Quels sont les défis pour la 11e épidémie?
Professor Muyembe?
Oui. Bon, je crois qu'on m'a parlé un peu des progrès pour la recherche, notamment pour le séquençage. Quelqu'un a parlé, n'est-ce pas, du séquençage. Et la RDC est le pays qui a donné le plus de séquences de la COVID-19. Et cela est dû vraiment au partenariat entre l'Institut national de recherche biomédicale et d'autres institutions du Sud, telles que l'Institut Pasteur de Dakar et les institutions du Nord, telles que l'Université de Nebraska, l'Université de Montpellier et USAMRIT, n'est-ce pas, aux États-Unis. Nous avons pu acquérir des machines pour le séquençage. D'abord, nous avons commencé avec Ebola. Et maintenant, les mêmes machines nous aident donc à faire les séquences de virus de la COVID qui apparaît ici en RDC. Nous sommes donc, en ce point de vue, le plus grand fournisseur en séquençage, dans les séquences, n'est-ce pas, du virus de la COVID. Et également, l'INRB a eu de nouvelles installations, de nouveaux laboratoires grâce à la coopération japonaise, ce qui nous permet donc de travailler en toute sécurité dans les nouveaux laboratoires P2 et P3 à l'Institut. Alors, le plus grand défi pour nous, pour l'expansion de la COVID-19, bien sûr, pour une maladie qui n'a ni médicaments, ni vaccin, le plus grand défi, c'est vraiment de trouver un vaccin efficace pour vacciner le plus de personnes possible et ainsi obtenir une immunité, n'est-ce pas, dans la population. Oui, alors pour la 11e épidémie, le plus grand défi pour nous, c'est d'avoir donc cette implication de la population. Une fois que la population est impliquée dans la lutte avec tout le matériel que nous avons donc le diagnostic à l'épicentre même de l'épidémie. Là où il y a l'épidémie, nous avons mis un laboratoire de diagnostic. Et puis, la vaccination des contacts des cas confirmés et l'isolement et traitement spécifique des malades. Là, je pense que nous pouvons vite mettre fin, n'est-ce pas, à cette épidémie. Bien sûr, à condition que le virus ne puisse pas se répandre, parce que dans la province de l'Équateur, le plus grand défi, c'est un défi logistique pour atteindre les cas qui sont dispersés. Et c'est une région où la population n'est pas très dense. Donc, les cas qui se dispersent dans les villages et dans les coins reculés, parfois inaccessibles par route ou par vélo, et même par canot rapide, là, ce sera donc un grand défi.
Professor, thank you very much. And I just would like to remind the speakers that we are working within a certain time frame. So please don't take it as my rushing you or we're not listening to what you're saying, just trying to keep within the allocated time frame. So let me now take the opportunity to welcome and introduce the WHO Director General, Dr. Tedros Adhanom Ghebreyesus has now joined us. He joins us from Geneva, Dr. Ghebreyesus, a very good afternoon to you. I hope it is afternoon where you are, because it is where we are. And just to allow you to then speak to us a little bit more about the Ebola response. It's been a huge global effort, a partnership. How do we look at it from the COVID-19 response lens?
Minister of Public Health of the DRC, Professor Muyembe, Director General of the National Institute for Biomedical Research of DRC, Dr. Moeti, my Regional Director, dear colleagues and friends. Today is a joyous occasion. I'm delighted to celebrate the end of the Ebola outbreak in the Eastern Democratic Republic of the Congo. As you know, I visited DRC many times during this outbreak and would have liked to be there with you and the response teams to mark today's important moment. However, I look forward to the day I can congratulate you in person. The Ebola outbreak added to the burden of communities that have endured years of conflict. But during this time, the immense response was rolled out, led by the government and brave and talented Congolese responders and colleagues from many partners who joined forces to save lives and protect health. The team effort was led by the DRC government and supported by WHO and many partners. There have been many achievements, as you know. Over 1,100 people contracted Ebola have survived and returned in good health to their families and communities. This is a testament to the care provided by Congolese health workers, supported by WHO and other partners. And of course, above all, the government's commitment. The Ebola response was a victory for science. The rapid rollout of a highly effective vaccine saved lives and slowed the spread of Ebola. For the first time, the world now has a licensed Ebola vaccine, and effective treatments were identified that dramatically lower death rates when patients are treated early. A special praise goes to the epidemiologists and case trackers who went door to door to search out newly infected people. We must not forget the health workers who lost their lives. WHO will keep advocating for the security of health workers to perform their duties without being targeted. While we celebrate the outbreak's end, we must resist complacency. In addition to COVID-19, the world's largest measles outbreak has wrought havoc in DRC, killing thousands of people in less time than Ebola took to claim. More than 3,400 victims during this latest outbreak. Only half of health facilities have water access, a determinant for spreading infectious diseases. And as we have seen with Ebola's emergence in Equator province, viruses do not take breaks. There is still the potential for flare-ups, and rapid response teams and support systems must remain in place. Ultimately, the best defense is defense against any outbreak is investing in a stronger health system as a foundation for universal health coverage. WHO will continue working with DRC to ensure all Congolese benefits from UHC and are protected from future health risks. Once again, WHO is celebrating with you and with all the people of DRC. Congratulations to Minister Eteni, congratulations to Professor Muyembe, congratulations to DRC, and congratulations also to President, to His Excellency, the President, and to the people of DRC. So I thank you and all the very best from my side. Thank you so much.
Dr. Tedros, while we still have you on the podium, there's some questions that are coming through. So this one is from Gabriela Stanhauser, Wall Street Journal in South Africa. She says, what countries and regions do you think or see as hotspots on the continent now? This is with regards to COVID-19, and would you say that transmission is out of control? Question from Nabilek Sheikh, ETV South Africa, saying, given the situation with South Africa having the highest number of COVID-19 cases on the African continent, are there any additional measures that the country should be implementing currently? Dr. Tedros, would you like to answer that, please?
So can you repeat the first question?
So the first question was about hotspot areas on the continent. And is there any particular country that you believe the transmission is out of control?
So what I would prefer actually to forward this question to my sister, Dr. Moeti. Are you online?
Yes, Dr. Moeti is with us. Dr. Moeti?
Yes, so hi Tedros, welcome. And thank you for those great words about the Ebola outbreak. Yes, which countries are seeing a continuing rise in numbers of cases? I mean, certainly South Africa is the country that's leading. As I said in my remarks, over 50% of the cases are there. And we also have a similar situation in Nigeria, increase in Cameroon, in Cote d'Ivoire, in Ghana, in a number of countries where we are seeing, particularly after, as I said, governments have had to really try to balance whether the public health interventions, including the social distancing measures, which we think served to slow down the pandemic, to flatten the curve somewhat, and the huge need to continue and open up now economies, livelihoods for people. So this is what the countries, including these countries, are balancing and trying to adjust. So these are some of the countries where we are seeing an increase in numbers of cases. Zambia is another one, for example. So I would say these are what one might call among the hotspots in the region.
Thank you, Dr. Moeti. So this question is from Sam Eferraro. How effective is the Ebola vaccine, and to what extent did it contribute to the control efforts in the Congo DRC? He writes from Africa Health Time in Nigeria. Dr. Tedros, I'll bring it to you first, and then we can come to Dr. Eteni Longondo if you may want to weigh in on that.
Again, I think when we have the best expert, I would prefer to refer that to Professor Muyembe, who is our pride, by the way, who discovered the treatment for Ebola. And he has also led the response, as you know, and he's an expert on vaccines. So Professor Muyembe, if you don't mind, I would be happy if you can say something about the effectiveness of the Ebola vaccine.
Oui, donc le vaccin que nous avons utilisé, le vaccin Merck, a montré une grande efficacité. Donc, plus de 80% de personnes vaccinées sont protégés, et ceux qui sont protégés, qui ont reçu le vaccin, mais qui quand même développent une infection, l'infection sera relativement bénigne. Et ce qui fait que ce vaccin a été donc recommandé pour l'utiliser dans le cadre donc de vaccination en ceinture autour des cas confirmés, vacciner tous les contacts, et cela a aidé à contribuer à la lutte et à la victoire que nous connaissons aujourd'hui contre la maladie à virus Ebola.
Thank you so much, Professor. Professor Muyembe, could you please repeat your last sentence?
Je disais donc, les personnes qui sont vaccinées, ce sont les contacts des contacts et qui sont les contacts donc des cas confirmés positifs pour Ebola. Et ce qu'on a constaté, c'est que plus de 80% des personnes vaccinées sont protégées et ceux qui sont vaccinés, mais qui développent quand même la maladie à Ebola, vont faire une infection bénigne par rapport à ceux qui ne sont pas vaccinés. Donc, la mortalité est faible parmi ceux qui ont été vaccinés par rapport à ceux qui n'ont pas été vaccinés. Et donc, ces vaccins, d'abord, il n'a pas d'effet secondaire et ce vaccin a aidé à maîtriser l'épidémie, la 10e épidémie en République démocratique du Congo.
Thank you, Professor. So here's a question now for Dr. Longondo. It's from Johan de Toy. Johan de Toy writes from Longevity magazine. And his question is, Dr. Eteni, how would you say has the public been made aware of the strategies to use in fighting the different outbreaks?
I'm sorry, can you repeat the question, please?
It's around the public health education around fighting the different outbreaks, the strategies. How is that being communicated?
Bon, je crois que effectivement, nous avons connu beaucoup d'épidémies ici au Congo et nous avons développé beaucoup de stratégies par rapport à la lutte contre ces épidémies. Alors, ces stratégies, n'est-ce pas, sont développées par plusieurs, d'abord par le pays, et nous associons aussi les partenaires qui nous aident dans l'élaboration de ces stratégies-là. Alors, ce qui est fait ici au Congo, c'est que au niveau de la communauté, nous avons une stratégie que nous communiquons à la communauté, et aussi au niveau des structures de santé et au niveau de tous les secteurs de santé, nous avons des stratégies que nous communiquons souvent. Nous organisons des réunions avec les acteurs et nous organisons aussi des réunions avec les partenaires et pendant lesquelles nous communiquons ces stratégies. Mais nous pensons que, en tout cas jusque-là, par rapport aux stratégies que nous sommes en train de développer, nous avons des résultats qui font que maintenant, nous arrivons à éradiquer la plupart de ces épidémies. Bon, je ne parle pas seulement ici de Ebola et de la COVID-19, mais aussi nous sommes en train de connaître une épidémie de la rougeole que nous sommes en train de maîtriser aussi. Donc, nous élaborons de bonnes stratégies et qui fait que nous puissions être capables de maîtriser les épidémies, les différentes épidémies que nous connaissons.
Thank you so much, Dr. Longondo. Dr. Moeti, I believe you wanted to add on to this.
Yes, thanks very much, Tsepiso. Just first to add on to this specific question about the community, which is also what I was going to say to complete the response on South Africa. I'm sorry I didn't answer that question completely. One of the big strategies that was used in the DRC is really to engage communities at their level, go down to the grassroots level, use the associations. I know that associations of women, of youth, use the churches really drive towards a more interpersonal communication so that people have the information provided by those that they know, those that they trust, from whom they can accept this information, where they have the opportunity to ask questions, to clarify, to state their beliefs even, and have these addressed by the communication. I would observe that was one of the most important aspects of this communication in the DRC and in other outbreaks. In relation to South Africa, the question was asked, so what more do you think the government is doing enough? What more could they do? I have to say that we think that the South African government has done absolutely the right things, and they intervened early, not only in terms of scaling up the public health capacities for testing, contact tracing, but also imposing the very comprehensive lockdowns, and then confronting what I think is a very common issue, as I said in my remarks, that there's a need to balance. After a certain point, when the lockdowns have bought you some time to scale up the public health interventions, there's need and there's pressure, we know, to relax some of these. We are seeing now a differentiated approach where the hotspots are being targeted particularly strongly, places like the Western Cape and Gauteng province. And we think this is absolutely appropriate. What we observe is that, for people to internalize these behaviors, as I said, really takes a very specific type of communication and a combination of means of communicating with the radio, television, social media, but very much getting down to the community level, associations and groups. And this, we believe, not only in South Africa, but in other countries, is something that needs to be improved. In addition, we see that in the hotspots, being able to get test results quickly, identify contacts quickly, and then create the space for isolation, because we know that in some of the areas, it's very difficult for people to self-isolate at home if they're living in crowded conditions in the house. And in places where you have a lot of cases, you really do need to create the space safely to take people away from the homes, to isolate them and break the transmission chain. So this is what I wanted to say. But overall, we think the government is doing the right things. Of course, we appreciate the situation is hugely challenging to maintain this balance. Thank you.
It's typically when you run out of time, the questions come in fast and furious. So I'm going to ask those who send questions to truncate them, and to the speakers to answer as short as possible. So this next question is for Professor Muyembe. It's from Hereward Holland, Reuters, DRC, UK. Can WHO INRB representatives describe the impact of the backlog in testing on case management? If a quarter of those being tested in Kinshasa are positive and 80% of them are non-symptomatic, can we infer, if we extrapolate across the population of a city of 12 million, what can we infer? So it's about the case management for testing and the backlog. Professor Muyembe?
Oui, bien sûr. Quand nous avions commencé le test de diagnostic, notre capacité était de 50 tests par jour. Aujourd'hui, hier par exemple, nous avons fait 800 tests par jour. Donc, c'est un effort énorme. Alors, pour accélérer donc le rendu des résultats, nous avons maintenant décentralisé, parce que il y a de plus en plus de tests qui sont produits en Europe, aux États-Unis et en Asie. Donc, l'accès aux tests devient plus facile et nous avons donc décentralisé. Maintenant, nous utilisons 2 plateformes, ou même 3 plateformes donc, de biologie moléculaire. Nous utilisons donc la biologie moléculaire traditionnelle et puis les gene experts. Et les gene experts, nous avons répandu dans les provinces. Dans les provinces, on peut maintenant faire donc les diagnostics moléculaires. Et également, on a ajouté les tests rapides pour la sérologie, également pour la recherche des antigènes. Bien sûr, lorsque les résultats viennent en retard, il y a un impact sur la prise en charge. Mais comme je vous ai dit, donc, cet impact négatif est de plus en plus donc résolue et nous n'aurons plus de problèmes. Alors, vous dites, est-ce qu'il faut tester tous les cas, faire donc un dépistage massif, le dépistage de masse, bien sûr, simplement pour dire aux personnes qui sont infectées, mais qui ne manifestent pas de symptômes, ces personnes donc de prendre des mesures, de se comporter en responsable pour éviter de transmettre le virus dans son ménage ou bien autour de soi. Mais bien sûr, ça demande beaucoup de moyens et beaucoup d'énergie, mais nous nous concentrons avant tout sur ceux qui présentent des symptômes. Ce sont ceux-là qui constituent notre priorité. Et je pense que plusieurs pays ont cette stratégie également. Voilà.
Thank you so much, Professor Muyembe. This question is from Marian Mitambo, travel writer on scrapbook journeys from Nairobi, Kenya. It's directed to you, Dr. Tedros. The question is, when are we likely to see the borders reopening for travel again? And are we likely to get to a point where we learn to live with COVID-19 as part of our lives? If so, what measures would governments and citizens need to start putting in place to make this happen? So I suppose it's more about international travel and cooperation between countries and how we protect each other.
Yeah, thank you. Thank you so much. As you rightly said, of course, countries are opening up now. And as you know, lives and livelihoods were at stake. And people should go on with their lives, especially for those with low income and their income that depends on daily wages. Anyone can imagine how much difficult the lockdown could be without any social support. So based on the situation, countries are, of course, opening up. So our advice is the opening up should be measured, phased, and well organized, and at the same time, even continuing to strengthen the testing, the case, the contact tracing, isolating, and quarantine. Of course, implementing the comprehensive approach will be very important to continue to implement. So these are some of the things that the countries are doing. And from the rate of acceleration of the virus now, the pandemic, I think it's highly likely that this virus will live with us for long. And that's why, while taking the comprehensive measures, we need to prepare to live with the virus. And in addition to that, of course, we need to have also the long-term solutions, investing in vaccines, which we're doing, investing in treatments, and simple and user-friendly diagnostics will be very, very important. And that's why we have the ACT Accelerator initiative that was launched on April 24 by WHO and partners with two objectives. One is to speed up the development of these tools. And the second is to have an access to those tools by anyone who needs them, and especially vaccines for the world to treat them as a global public good. So when we're opening up now, we need to do the immediate, whatever we have at hand, using whatever at hand, the things I have outlined, but at the same time, we need to do the long-term solutions, and that can help us to address the pandemic.
Dr. Tedros, thank you so much for your time. I understand that you do have to leave, so we would like to thank you for participating in this first ever Africa online briefing for the WHO in Africa.
Thank you very much. Thank you for having me.
So let's move on now to Dr. Longondo. There's a question for you, Dr. Longondo. It's about Ebola is over in the Eastern Congo, but people cured of the epidemic are called to be monitored for 12 months. What does this follow-up consist of? This is from Congo. Okay, so sorry, that's the question. I'll tell you who it's from in just a moment. It's from Claude Segenya from, yes, actually it's Congo. So can you answer that question, Dr. Longondo?
Merci beaucoup. Comme vous le savez, dans notre stratégie, nous avons pris des mesures parce que même si nous déclarons la fin de l'épidémie à Ebola, aujourd'hui, il faudrait faire un suivi au niveau de la communauté, au niveau du système, pour que nous nous rassurons du fait qu'il y a un renforcement de capacité au niveau local et aussi au niveau de différentes communautés. Donc, nous allons donc à l'est du pays, là où nous avons déclaré la fin de l'épidémie aujourd'hui, nous allons laisser une équipe, n'est-ce pas, du niveau central et quelques partenaires pour assurer le suivi des mesures post-Ebola, notamment les mesures de renforcement de capacité, les mesures de suivi de quelques malades, comme on le faisait aussi à Mbandaka, donc des gens guéris, mais de temps en temps, on peut toujours tester leur sperme, ainsi de suite, et des mesures de renforcement de capacité en général. Donc, nous avons des équipes pour faire cela selon la stratégie que nous avons élaborée. Et c'est ce qui nous a manqué dans la province de l'Équateur, tout simplement parce que quand nous avons déclaré la fin de l'épidémie dans la province de l'Équateur, il y a eu déclaration d'une nouvelle épidémie à l'Est. Et c'est tout le monde qui est parti là-bas, en laissant donc la province sans suivi. Et je crois que cette fois-là, c'était une leçon qu'on avait apprise. Nous allons nous assurer que la communauté locale a la capacité et aussi que ce soit à l'Est et à Mbandaka. Donc, voilà ce que nous allons faire pendant la période post-Ebola.
Because this is almost the end of this briefing, I'd just like to ask all the speakers, Dr. Longondo, because you were just speaking, to, in 30 seconds, have your final say on this particular issue, the fight against Ebola and COVID-19.
Je crois que par rapport à notre expérience, nous pensons d'abord que Ebola, avec le vaccin que nous avons maintenant, la lutte sera beaucoup plus facilitée par rapport et au vaccin et au traitement que nous avons, et aussi par rapport à l'expérience au niveau de la communauté. Et nous sommes en train de capitaliser cette expérience pour lutter aussi contre la pandémie à coronavirus. Mais nous sommes en train aussi d'avoir quelques difficultés au niveau de différentes communautés par rapport à cette pandémie, parce qu'il y en a qui ne comprennent pas que c'est une pandémie dangereuse et qui existe au Congo. Alors, avec le partenaire, nous sommes en train de renforcer la communication, et le secrétariat technique qui est dirigé par le professeur Muyembe est en plein travail là-dedans. On est en train de renforcer la communication et nous sommes en train d'équiper le relais communautaire qu'on appelle ici dans notre jargon le RECO. Et nous sommes en train aussi d'équiper les différents leaders de communauté pour que la communication se passe très bien et que notre population sache que nous sommes en grand danger.
Thank you so much, Dr. Longondo. Professor Muyembe, if I could just also ask you to very, very briefly, 30 seconds, your final word on this, the lessons learned and what to do going forward.
Merci beaucoup. Bon, pour nous, donc, Ebola est fini, mais nous n'allons pas baisser la garde. En ce qui concerne la province de l'Est, nous avons un grand nombre de personnes guéries et qui sont également une source potentielle de transmission sexuelle qui peut surgir d'un moment à l'autre. Et nous avons mis donc sur place une équipe de recherche qui va donc suivre tous ces cas de personnes guéries, surtout des hommes. Et nous pensons aussi qu'il faut mettre en place un système, un groupe de chercheurs pour suivre, tester de temps en temps les cas de décès à domicile pour éviter aussi des surprises, des reprises de Ebola dans les communautés. Voilà ce que mon institut de recherche a comme projet de recherche post-Ebola dans l'est de la RDC.
Thank you so much, Professor. Dr. Moeti, just a final word to you. I'd imagine strengthening protective systems is very much at the forefront of the way forward with regards to not only Ebola, but COVID-19. Your words on this?
Yes, absolutely. I think just what do we need for this to be a success, whatever is the virus. By the way, we also had a wild polio virus is going to be declared eradicated from the region. All this also happened last week. So I think we need leadership. We need partnership. We need science and innovation turned into interventions and services quickly. We need solidarity. I'll say this is very important within countries at the international level. And most importantly, we need people who are informed, knowledgeable, empowered, and able to take action for themselves and as part of what the government is trying to do. When this happens, we can succeed, whatever is the virus or the organism that's threatening us. Thank you.
Thank you very much to you, Dr. Matshidiso Moeti, the WHO Regional Director for Africa. And I must also acknowledge he has been with us, but not participating, Dr. Michelle Yao, who's with Dr. Moeti. And I want to also thank Professor Jean-Jacques Muyembe. Thank you very much, Dr. Eteni Longondo, and of course, Dr. Tedros Ghebreyesus. Thanks to all of you, my colleagues. I do apologize. I know so many questions, but time is the enemy. Hopefully you don't see me as the enemy. Do please join us in a fortnight's time for this, the WHO Africa online briefing with the APO. I do hope that you were able to get what you needed, and we continue learning as we continue fighting. Thank you very much.
Thank you.